A great time to get started. So thanks for being here. My name's William, one of the psychiatry residents helping to run YPSG. I am going to turn things over to Alec Lerner, another one of the residents helping to run the group, to introduce our speaker today.
All right, yeah, so thanks for coming for another Yale Psychedelic Science Group speaker series. So tonight we're having Dr. Hannah McLane, who I've had the pleasure to get to know over the last year and a half or so, just like sort of randomly reaching out to her, and she's been really gracious with her time as a mentor, really awesome person. So I'm excited to have everyone get to meet her. So Dr. McLane trained in medicine at Brown, did a master's in public health at Harvard and focused on global health and bioethics, and completed residency in neurology and occupational and environmental medicine at University of Pennsylvania. And since then has been involved in a number of things and is trained in psychoanalysis, a lot of psychedelic-assisted therapy trainings, including MAPS, and has also founded this really, really cool clinic and research center called SoundMind, which we'll get to hear about tonight. And one of her main focuses and passion is making psychedelic therapy more equitable, more inclusive, and focusing on often marginalized populations and how we're going to roll this out in a way that's ethical and good for all. So I will turn things over to her, and feel free to, we're going to have people, you can unmute yourselves and ask questions. It's a pretty free format. So thanks for being here. Thank you.
Good to see you, and thanks for the intro. It always sounds like I'm very overeducated when people do an intro and I'm like, I know I did a lot of stuff. So I would love if people could turn on their cameras, even if you turn it off later when I'm giving a lecture. I would love if you could just turn on and just like wave and like so I can see who's here. Awesome. And so, and I think like scroll around and see other people, because I'm sure some of you, know each other and some of you don't. So it's cool to see faces. If you don't know how to change your name so that I can, if you want to just like put in parentheses, like what you do, like, are you a psychiatry resident? Are you my mom or dad who happen to be here? You can remind me who you are. You go to the three dots in the upper corner of your picture and you pick rename, and then you can say anything that you want to say about yourself. So it helps me also know like who I'm talking to. Maybe you're a yoga teacher or, community member or, psychedelic facilitator, whatever you are, that helps me know. And I guess I would love to see a show of hands, just like who's in like medical education or residency or, a practicing doctor now. So like maybe a quarter of you from what I can see. So the others of you, tell me, a few of you can tell me what who you are. I'd love to know. Do I have a volunteer with like a hand raise? You can do a little like emoji hand. Or just chime in. Or put it in the chat for each other to know.
I don't mind.
Hey, everyone all at once. Go.
I'm a pharmacist here in New Haven.
Awesome.
At the mental health center.
Great.
And my name is Teresa, and I work at a halfway house for women who are formerly incarcerated and would love to be involved in getting psychedelics to this population.
Cool. Amazing.
I am a licensed marriage and family therapist, and I own a ketamine clinic in Oakland, focused on BIPOC and queer folks having access to these medicines.
Hey, Courtney. Good to see you.
Hey, Boo.
I'm a wellness advocate and just like gathering people, like-minded people to gather together to make things happen, and live in the Seattle area.
Awesome. So how many people are actually practicing a form of psychedelic facilitation now? Okay, cool. Awesome. And how many people want to do that? Okay, great. Okay, now I feel like I know my audience. Cool, so I will just start with slides. Again, if you want to keep your video on, that's great. But also totally not offended if you want to shut it off and like make dinner or whatever you need to do in your lives. So I am going to talk about SoundMind Center. Alec, can you spotlight me just so people can still see my face?
I can try. I'm able to see your face. Can
Oh, you
others?
are?
Yeah. Can people put in the chat if they can also see Hannah?
Okay, cool.
Cool.
As long as you don't feel disoriented. Okay.
Great.
So I'm going to talk about SoundMind Center and some aspects of like development of the concept and the place, and sort of a little bit about how I got where I am. I've never done this presentation before, so it'll be interesting to see how long it is and where it goes. But this is what Alec asked me to present on, and so we're going to tell you a story. So again, my background. So I have a lot of degrees. I sort of did a meandering way into medicine. I studied international development at McGill. I wanted to do something clinical, and I thought like, okay, medical school is like way too long. I'll become a speech therapist, and then got really involved with and really passionate about language and the brain. I was like, I want to be like Oliver Sacks, and ended up deciding to do a pre-med post-bac program at Bryn Mawr outside of Philly, and then did a direct admission to Brown Med School. Took a year to do public health at Harvard and focused on ethics and global health, and just really fell in love with that as a worldview and an area of interest. Did some neurology, did some occupational environmental medicine, and ended up, I will tell that story in a minute, but I ended up starting psychoanalytic training here in Philly, and while I was doing my patient safety fellowship at the VA. So residency, so I basically had, I started feeling like I was seeing psychosomatic illness everywhere. And these, I would have patients that I would say probably at Penn, it's maybe 30% of patients that come in to neurology actually had underlying PTSD and a psychosomatic presentation, and anyone in psychiatry would know that, and most therapists will know that too. I was fascinated by this group of people, and I really wanted to help and felt like I didn't know what the tools were to help them. And I sort of was one of the only neurology residents that didn't mind taking patients that were like maybe psychosomatic or had a lot of mental health things going on. So I started developing as a resident kind of a caseload of people, because they're like, oh, migraine patient that we don't know what's going on, like Hannah will see them. I felt like there must be a better way. And it was actually a rotation in psychiatry. Like when I was a neurology resident, I rotated through psychiatry, and I told one of the attendings that I was really interested in psychosomatic. Well, I told him I was interested in patients that would come in with physical ailments. And he said, so so let me get this straight. You're frustrated that you wish you had tools to help these patients, and you are frustrated that neurologists don't want to help these patients as much as you'd want to help them, and you're thinking of leaving neurology to investigate like helping this group of patients. And he was like, I know someone you should read about. I was like, oh, you mean like, is it someone I could meet? Is it someone at Penn? And he's like, no, just go, can you go read about Freud? I was like, wait, what? No, I don't want to read about Freud. And he was like, it's this exact same story. Like, you're interested in what we used to call hysteria. You're a neurology resident. You're frustrated. So I ended up going into applying to be a psychoanalytic candidate at the local center here. And I don't consider myself a Freudian by any means, but it is based on that original body of literature. And that sort of started a whole other set of interests for me. And then in 2018, I ended up at the Sleeping Octopus Assembly on Psychedelics, which was in a psychedelic conference in Pittsburgh, and had a long conversation with Rick Doblin. And they showed a video of a patient getting treated with MDMA. And to me, that was like, that did it. I was like, this is what I want to do. These are my patients. They need me. This is the way to treat them. So I went up to Rick. I'd like never talked to him before. And I was like, I'm new to everything, but I'm like, I'm dropping everything and doing this. And he's like, great, welcome aboard. So he's been an amazing mentor and supporter for me through the years. It's been not easy trying to put things together here because there wasn't much support back then. It speaks for itself, and really, I think every time I watch that, I like cry a little bit. And it's just really inspiring to see the amount of healing that can happen in these sessions. And that was only, it's 3 sessions. And those are just three days of his life, so people can go for 20 years. And I mean, I'm sure I'm preaching to the choir, but people can go 20 years trying everything. And we have these tools that can essentially heal them in 3 months. So it's very incredible. I'm going to share my screen again. Second. All right, so after that presentation that I saw at the SOAP conference, and started thinking about what I wanted to do as a psychoanalyst and all these different degrees, and started really contemplating the ethical dilemmas and the issues that we would have to face. So this was before SoundMind even existed, before I had any concept of that, but started realizing like, who's going to access this care? How much is it going to cost? Noticing just in psychedelic circles, some sort of like dismissive messages towards people of marginalized groups, just like this concept that like, if we did more psychedelics, maybe, we're all just one. It's, your feeling of oppression isn't real. I even started noticing that early on, just like, get over yourself, kind of, it's subtle. It was, I mean, sometimes it's not so subtle, but I think in good conferences, people are not going to be overt about that, but it feels like there's something off. There was this really strong interest in inclusion of all different groups in the research phase, and just conversations with my Jamaican friends. I was trying to say like, we're trying to include more people of different groups in research, and they were like, no, people don't want to be part of research. Like, we've been researched on Jamaican people for so long. I was trying to explain to them that people are going, different companies are going down to Jamaica and setting up shop because psilocybin's legal. And I was realizing like, oh, it's really hard to even grapple with that it's like, yeah, there have been ethical violations towards Black communities in the medical community and the healthcare world. And now we're like, sure that psychedelics are going to work, but it's still research, and so that's difficult. I've worked a lot with Joseph McCowan over the last 3 years, and he's a Black man in Los Angeles, and he talks about the triple stigma of psychedelics in BIPOC communities. So in West Philly, 80% of people are Black. The triple stigma being the stigma of psychedelics in BIPOC communities, the stigma of mental health, and the stigma of research. So in order to enroll someone in a trial, they have to get over, I think there's even a fourth one he started using, I forget now, but there's so many barriers to be inclusive in research, and really research is what we have, at least in the above ground medical world. So he was, working at that. I met him a little bit after the SOAP conference. He was working on trying to enroll more diverse people in the trial he was participating in with MAPS. Thinking about the importance of stability in one's life to be able to undergo psychedelic treatment. So even if we, the question is like, will it be covered by insurance? But even if it is, there's a certain amount of like opening that has to happen for someone to go deep into their trauma or their memory. And that can create a like a vulnerable state even days after the therapy, you know, needing to go home and like have space to journal and to integrate. If someone doesn't have a stable home, you know, it's really hard to do psychedelic therapy if we don't have somewhere safe for them to sleep after. So there's just so many resources that we need to really be inclusive. Concepts of indigenous reciprocity, and this is stuff I teach in my class now, but and so this, a lot of these topics can, you know, could take weeks to go through, but just the concept of like even in the above ground medical world, a lot of these practices come from indigenous ways of doing it. So I think, you know, some people argue that if we're using like psychedelics that are made in a lab like MDMA or LSD, that it doesn't, you know, indigenous reciprocity isn't relevant. But I really feel like it would be unlikely that the medical community would have come up with this concept of like sort of setting up the set and setting and ceremonial and this amount of hours and like how you hold someone, and like it's hard to say that it could be have ever happened if it was totally separate. And so I think the indigenous reciprocity is always relevant. There's issues with the how we define PTSD, and I think you, Dom, talked about this in your last talk, but just the idea of an index trauma, and that if someone has chronic everyday traumas, or ones that don't quite meet the index trauma level, they won't be necessarily considered as someone with PTSD, and then you can't enroll them into one of these trials when the picture is one of PTSD. The idea that even just to find a trial, like to end up at the doorstep of a clinic that's doing a trial, you need a pretty high health literacy to be able to like know that you have a diagnosis. You have to, you know the symptoms of your diagnosis, know the name of it, search online what, you know, I'm looking for a clinic for treatment resistant PTSD. That requires a lot. And then these dilemmas around informed consent, around touch, and vulnerable populations. So I'm really interested in working with neurodiversity, like autism, dyslexia, ADHD, and even without having neurodiversity, there's so much with informed consent, and like how do you decide what, you know, what the future you is going to want and what you're going to allow, and people maintaining boundaries. And I'm sure a lot of us have been following the recent controversies and accusations about boundary violations within the psychedelic community. So these issues are coming up, and it's, you know, it really is a lot for us to grapple with. This was like 3 years ago, and I was thinking like, oh my God, there's so much work. You know, I ended up the year after that conference, I ended up going back to they hosted it a second time, the SOAP conference, and I presented on PTSD and like ethics around psychedelics. So presented some animations I had done for the Harvard School of Public Health, and like the ethics of inclusivity and distributive justice, and how we sort of think about how you distribute scarce resources. So also very relevant in a pandemic. But I think that got a lot of people thinking too. And still 3 years later, I have people say like, oh my God, that presentation, because you can actually find it online, but it really makes you think about your values and like how you're moving through the world. And I've done some education initiatives around this. So some of those dilemmas led to some different projects. So we did, I worked with Rick Doblin and MAPS on this Animations for Access project. So this is Joseph McCowan, the one in LA. And just talking, you know, I talked to him a lot about like, you know, I think even instead of educating people about like, just about psychedelics, it's like we need to educate people about what PTSD is in the first place, and then like how it relates to psychedelics to really help people understand like what are we even talking about. So I did want to show this too, and it's just a few minutes, and it's been viewed, I think, like, I don't know, 20,000 times. MAPS has it uploaded on their site, so people are it's been used. Let's see. tell me if you can hear this.
MDMA is a medication that was invented in 1912 in a lab by Merck Pharmaceutical Company. It is actually the name of a molecule, 3,4-methylene dioxymethamphetamine, which looks like this. The medication is usually taken as a pill. In the 1970s, scientists realized that MDMA could be a powerful addition to psychotherapy, meaning that when it was given and then a person got psychotherapy for things like stress, trauma, or other issues, it appeared to make the therapy work even better. Many therapists and psychiatrists began using it in this way with their patients. Around 1980, people also started using this drug outside the medical context and started calling it ecstasy. Unfortunately, in 1985, the US government made it illegal to use, both on the street and for medicine. A little over 20 years ago, doctors again began looking at MDMA for medical purposes. One area they are investigating is using MDMA for post-traumatic stress disorder, specifically for people who have tried other treatments that didn't work. Post-traumatic stress disorder is a diagnosis that a person gets if they have experienced a trauma or a series of traumas and then have a reaction to it that affects their life and functioning in an ongoing negative way. Symptoms can include flashback memories of the trauma, trouble sleeping and nightmares, and a constant sense of needing to be on guard, hypervigilance, or emotional numbing. Another symptom is dissociation, the feeling that one's body and mind are separated. The fact that this can happen when memories of the trauma occur makes it particularly difficult to treat, because looking into the memory and staying present with the emotions is important for treatment. The diagnosis of PTSD can be made by doctors, psychologists, and others, and is based on a questionnaire called the Clinician Administered PTSD Scale, or CAPS, which involves a description of the traumatic event and the symptoms. When getting MDMA medication to treat PTSD, a person is first asked to describe their trauma and symptoms, and then a determination is made as to whether this is the right treatment for them. If so, they will then see two therapists, usually a male-female co-therapy team, over the course of several months for a total of around 12 to 15 sessions. Most of these sessions are 1 to 2 hours long, and 2 to 3 sessions are 8 hours long. These longer sessions are when the person receives the MDMA medication, and this also involves overnight stays at the clinic setting. During the MDMA 8-hour sessions, a person lies on a couch or bed, listens to music, and says whatever comes to their mind. They usually spend about half the time listening to music with eye shades on, and some of the time talking to the therapists who are sitting with them. Part of this therapy approach is trusting that a person's mind and body have their own ability to heal. This has been found to be effective for many people so far. MDMA works best for trauma when given alongside psychotherapy. Scientists believe the medication may be working because it can help reduce fear about difficult memories and promotes a sense of trust and safety. And then the person may be better able to process their traumatic memory while still feeling safe. This approach to PTSD has been designated a breakthrough therapy by the Food and Drug Administration, given how promising it looks. The breakthrough therapy designation is for the most important drugs that the FDA is reviewing. Right now, the drug plus therapy combination is in phase 3 research studies, the final stages.
Cool. That was fun. I'm like remembering I was like cornered Rick at one of these conferences, and I was like, "You're reading my script," and he was like, "Okay." He read it. I was like, "It's not good enough. Try again." I kept making him read it over and over. Finally, we got it. But it's really interesting to think about, how do you illustrate some of these concepts, and what's the best way to help someone like feel understood if that's what they're experiencing. So there was a lot of back and forth with different folks around that and the animators, and I'm happy with the outcomes. So let's see. So we're back to here. So that's that. And then at the same time, we launched a program called the Solidarity Series, and actually it's ongoing. It's basically a series of free webinars that I sort of squeeze in whenever I have time. But again, it was originally going to be about just psychedelics, and we realized like, no, in order to be really inclusive, we need to talk about like, what is sleep health? What is insomnia? What is, so many different aspects of mental health that are important also. So not just being uni-focused on psychedelics. I'm also still working on some of those original ethics questions. Actually, we're coming out with a paper with Tim, one is Dan Wickler, another Tim, who were the original people that started this, wrote a paper that got known as a Ulysses contract of like binding your future self. So we're talking about that in the context of psychedelic therapy and like, the ethics behind how you decide what someone can and can't bind their future self to do. And for anyone who doesn't know that concept, it's Homer's The Odyssey and Ulysses and the Sirens. Ulysses says like, asks his men to bind his hands and so that he will hear the siren songs, but they've plugged their ears. So he said, I'll fight you, but I will bind my future self so that I'm not going to allow myself actually to go towards the siren. So I think it's very interesting how do we understand autonomy, and especially in the context of psychedelic therapy and neurodiversity. So right before the pandemic hit, I was looking for a site because I was really interested in becoming an expanded access site for MDMA-assisted psychotherapy with MAPS, and we needed a team and a site, and I couldn't find any landlords that wanted to host me and my psychedelic craziness like a few years ago before anyone knew what was going on. So ended up finding this building that was owned by Penn. It was rented by Penn Family Medicine for 20 years. So it was zoned as 3 apartments and 8 clinical rooms. And it came up for sale. And it was like probably the only building like this that's zoned as a medical clinic and also has apartments that I wouldn't have to get a variance for, that exists in the city of Philadelphia. You can get like a commercial place, but there's not, having a beautiful old Victorian home. So I was like, oh my God, this is the one. And ended up getting a loan to purchase it, and had big plans of rehabbing it very quickly. And then the pandemic hit, and it was not quickly. It took about 1.5 years, and it was kind of grueling. I had to the beginning of the pandemic, I had to separate the different contractors, and I was like carrying a lot of the tiles and painting myself, and getting it up to the standards of how I envisioned the psychedelic clinic. And at that time, putting together a team as well. So you can go on our website and see who all these people are, but we have wonderful folks on our team. And also started teaching. So I just started getting so much interest, especially from therapists in the region that said, like, I want to be involved. Like, how can I get involved? How can I learn more? Like, what does it take to become a psychedelic facilitator? Or some people are, doing work underground, and they say, I want to also, be able to work above ground. What do I need to do? So I launched these courses. So I'm on the 6th cohort of a training program. It was 12 weeks. I just added another 12 weeks, and the next one's enrolling for January. Alec also took this course, which is partly how I know him. And just bringing in experts from different areas of psychedelics and having them talk about, how one does become a psychedelic facilitator, and what are the skills you need, and what is the research behind it. And it's gone really well. And I think the biggest aspect of success is just the community that's being built. So we've trained about 130 people in the program, so it's 25 people each class. And just like there's so many amazing connections that happen in those classes, and people keep meeting, and we have a monthly meeting of people who have taken the classes, and it really feels like it's becoming like a really important network on the East Coast. So that's really exciting. I think a lot of leaders are coming out of that too. And we have worked to prioritize inclusion and diversity. When I first started the class, I required people to already be a licensed therapist, and quickly realized that that was not inclusive of different backgrounds. So many people don't have the opportunity to go to get a master's. So I really wanted to include those people too. And many people would, I realized people that really wanted to become facilitators, there's so many other things you can do other than be a main therapist. And there's also room to be a main therapist without being licensed. So I think that really the psychedelic ecosystem is opening up to so many different roles, and that's exciting. So we've given $25,000 in scholarships to 25 different BIPOC individuals. And we've trained, and we do like extended payment plans that go out to a year if people need that. And other people that have identified as other marginalized groups, and many of the students have commented it's like the most diverse psychedelic groups they've seen. So I really go out of my way to make sure that we have people from all different backgrounds. We have like mycologists and yoga teachers, and people are from Philly and people from Hawaii. So it's really fun. And I keep the classes small. I think it's very interesting with like the development of these like for-profit training programs. It's like they have these hundreds of people in their trainings, which, I think you can still learn, but I think it's like really keeping it small and really helping people make career decisions. I think that's what a lot of people are where they're at right now, and doing individual meetings. So we opened August 1st. So this is the opening party. Kept it pretty small because it was still COVID, and had different folks from the psychedelic leadership Zoom in. So you see Rick Doblin here, Marcelo DeLaura, who's in Colorado, and one of the main trainers at MAPS, and is just amazing, Colombian. Joseph McCowan, who's in LA, Tom Eckert, who got the psilocybin bill on the ballot a couple of years ago in Oregon. So it was really interesting also to have them all in one Zoom, because I don't know that they all talk all the time. So it was great to just hear their visions for the psychedelic, for a future of psychedelics that's inclusive and continues to be inspiring. And we got a lot of local press coverage. Some of it's been very interesting. The Philadelphia Inquirer, I think, was read by a lot of people. It's like, you can see the title here. It's like, SoundMind opens a psychedelic clinic in West Philly as momentum builds for treatment of depression, PTSD with mind-altering drugs. There's like a lot of that. It's like, oh no, like Philly, Philly is learning, what psychedelics are. And there was Philly Mag coverage, Penn covered us, one of the local NPR channels covered us. So there was like a period that was like, oh my God. So now everyone in Philly and the surrounding towns and everyone wants psychedelics. We don't have the capacity to address all the need. So I think there will be, I'm hoping that some of the classes that I'm teaching will make other clinics pop up, and there will be more than just us, but we're the only ones doing ketamine-assisted psychotherapy now in the region. This is what a session might look like at SoundMind. This is Steve, one of our volunteers, not a real patient, but we just wanted to take a picture to show people that there is touch and psychedelic sessions. It's like, usually reasonable like that. Sometimes you'll have your hand on their heart. You might hold their ankles. You might hold their head. And it's, it's very much just like gentle, comforting kind of touch. It was funny, the photographer that day, he was like, I don't know, should Steve be talking in the photo and smiling? You guys don't smile during therapy. And I was like, we do. Definitely smile sometimes during therapy. And other stuff that we're doing at SoundMind. So we're proposing an investigator-initiated trial with MAPS, which is exciting. That's getting submitted soon. That's with MDMA. we're working to have our courses fit into the Oregon requirements for psilocybin training. So they're not going to vote. The board in Oregon isn't going to vote on this until the spring. And so no one really knows what's going to be required. But as far as it seems from what's being voted on now, it seems like, certain courses that you've already taken can count towards the future certification. And I predict that there will be other states that take up the same educational requirements. So I think the folks in Oregon were like, yeah, if SoundMind wants to do a training, like, and send people out here for a experiential, that works. Does anyone on the East Coast want certification Oregon? And I was like, I think everyone wants certification Oregon. I think it will be relevant. And I really love that they are, I don't think it's an easy job, but they're working on including people that aren't licensed therapists in the main trainings, and that's who will be facilitators. So I really think like it's more inclusive than the medical model in a lot of ways that requires like this hierarchy and prescribing. So it will require that you have a facilitator with you, and they'll match people up. And potentially if someone has a lot of history of mental illness or on a lot of meds, they might have to get paired with someone that's a licensed clinician or a doctor. But most people don't need that, and the training programs will be about a year long. So I think, to me, it seems like plenty of time to get someone where they need to be to sit with someone, as long as the education is well done. And so just some final thoughts on inclusion, because that was one of the things I really wanted to talk about in this talk. So I think it requires a lot more than just like having an intention. It really requires like community buy-in, and people, in this, like the Philadelphia region and beyond, realizing like, if we really want to make this inclusive and ethical, it's a lot of resources, so like needing donations and grants, and realizing we actually do have to think about like housing security, and how are we going to do that? And even just thinking about on our wait list, we're selecting for people that already have therapists, so that when we're doing these sessions, that we're not going to be able to do like 6 months before and 6 months after. We're like trying to make any sort of dent in a wait list of over 700 people, and it's like we're going to have to focus on the psychedelic treatment and have other people do the other side, the preparation and integration, other than a few sessions for most people. And just thinking about like, if you're knocked out of the running, if you don't have a therapist or someone you can go to, that's a lot of people. So, thinking about like, how are we going to make it accessible? How are we going to, use our resources to create this infrastructure, I think. I think it's important also just to educate about, the difference between like a ketamine infusion clinic. Ketamine isn't the only thing we're going to do. We're definitely working towards MDMA and eventually psilocybin and potentially others too. But right now, ketamine-assisted therapy is what exists. And I think in this region, it's really us and a bunch of infusion clinics. And it's really hard for just for people to understand. I think sometimes that it's different models. If we're doing this for therapy, there needs to be a person in the room with the person getting the ketamine, and that is more expensive, right? You're paying someone to sit for 3 or 4 hours, as opposed to putting an IV in their arm and walking away. And I'm noticing some big IV clinics pop up and call themselves psychedelic, because it's like a hot word now, and it's really important to just educate what the difference is. And I think we need to be creative too. So we started out being like, we're just a nonprofit. We're going to do some education to keep afloat and do this rehab and then get donations and grants. And I've just become, more and more thinking like, you have to be more creative than that. It's like, we got to take certain people who can pay more, offer them some extra frills or some concierge version of this, and then subsidize people that get regular care, that might not need the frills, or take a certain percentage of everyone who comes in for treatment and put that towards marginalized people. And even just like, grappling with investors. Like, we don't have any investors right now, but, are there things that can be sectioned off so that we can actually like keep the resources going, because it's not right now, it's like, it's very hard to get donations in psychedelics. It's like suddenly that there's like millions and billions of dollars being talked about in psychedelics, and all of the donors just became investors. So, or many of the big ones. So I think just being creative and really educating the community about the importance of ethics and inclusivity now, and not like, let's do it in 5 years. And just and getting, you know, a diverse group of people together to come up with what these things look like. So Aubrey Howard on our team is really interested in BIPOC inclusion, and just like what that looks like. Will the playlist and the music look different? Do we do screenings of people to make sure that we're doing the right playlist for different cultural backgrounds? And really just like helping get folks together to talk about what these things should look like, and then working towards that. And also working with Indigenous communities for, you know, listening to what they need and what they would want from us. So potentially working with the Church of the Eagle and Condor and Belinda Ariacho, who's doing CAP treatment, ketamine-assisted therapy treatment for Indigenous women on reservations. And, you know, if there's are ways that we can make a dent in the trauma of the population she wants to help, we're really excited to collaborate. So I think there's a lot. It's a big job, and I'm excited that there's so much interest, and I think we can all do this together. But I don't have all the answers. I try to think as many answers as I can. And this is Rick Doblin visiting SoundMind. He said when we see our first MDMA patient, he will be there in person helping us treat them. So I was excited about that. And that's it.